Let's quickly take you to Trede in the Chumakwama district of the Ashanti region, where Health Minister Akufo-Addo is addressing the ceremony, which is the groundbreaking for Agenda 111.
To show to the people its commitment to improve the health status of all residents in the country. The surest way to improve healthcare is through providing new infrastructure or improving the existing ones across the length and breadth of the country. Your Excellency, I am aware of the strong desire of the Trede people to have this facility for which the Nanom readily offered land. The policy of the ministry is to provide facilities where communities are willing to provide adequate land for the project and to take care of future expansion. The Minister of Health, under my watch, has made significant progress in addressing the infrastructure gap in the health sector. Presently, some district hospitals and one polyclinic in the unlisted locations have been completed and handed over for use. Somanya in the eastern region, Weta in the Volta region, Tola to Nakalba, Gupe and Bamboy in the Savannah region, and Kolong in the northern region. Bekwai District Hospital has been completed in the Ashanti region. Tepa District Hospital has been completed in the Ahafo region, in the Ashanti region. Nsoko completed in the Bron region. Kifu Praso District Hospital in the Central region. Excellency, work is also ongoing, progressing steadily on the retooling and re-equipping of 4 health facilities in this region, namely Com Hospital at Aburi, Tetekwashi Memorial Hospital, Mambolipapim, Chebi District Hospital, and Atibi Hospital. Work is expected to be completed on these projects by November 2021. Excellency, work is also far advanced on the construction and equipment of 6 health facilities in the following locations in the Western region alone: Akontombra, Elubu, Bogoso, Takwa and Swawem, Wasadunkwa, and the upgrade of Umpoho Health Facility. These are due for completion in the second quarter of the year 2022. Excellency, the 45-year-old Ofanochi Teaching Hospital Maternity and Children's Block Complex has also started. At this time, I can make a firm promise, Your Excellency, that the project will be completed on schedule within your time. Other facilities which have witnessed similar sword-cutting ceremonies and have either started in earnest quite recently or will start within the next few weeks are as follows: the construction and equipping of 12-story maternity and gynae block at Kolebu Teaching Hospital, construction and equipment of urology, nephrology, and kidney transplant center at Kolebu Teaching Hospital, construction and equipment of Tema Sub-Regional Hospital, Nkranza District Hospital, Doma Accident and Emergency Center, and the construction of the Central Medical Stores at Tema. Construction and equipment of 12 new hospitals in the following locations: Jumapo, Kwabing, Nkwetia, Edukrom, Achiase, Suame, Drobonso, Sabronum, Mansum Kwanta, Hwedie, Mib, and Ponkatamanso. Your Excellency, will commence by early September by the contractor, Vamed Engineering. Mr. President, all these projects are in addition to the Agenda 111 facilities that you are about to cut short for the first one to commence at Trede here. At the community level, Your Excellency, work has been completed on the construction of 41 CHIPS compounds in selected communities across the length and breadth of the country at the moment. Mr. Excellency, all these 41 CHIPS compounds were started during your time and they have all been completed. Duals remains on the agenda of the government, and this, I promise, will be delivered without fail. Excellency, ladies and gentlemen, as we are testing today, the government is contributing a lot towards the equitable distribution of health facilities nationwide, and I will urge all partners involved in the construction of these projects to work assiduously to ensure that the projects are delivered on time with value for the investment. To address the COVID-19 issues, treatment centers have been constructed at the 37 military hospital, Pantan and Dodua. These have been completed and they are in use at the moment. Works are currently also ongoing for these treatment centers at the Kumasi Treatment Center at Sewa, at the Kulundevota region, Zebila in the Upper East region, Sevia Sawenso in the Western North, and Kolebu in Accra. Other sites are Sunyani, Takrady, Nalerigu, and Cape Coast. Excellency, all these treatment centers have got financial coverage, and we have promised to complete these in good time for our use. Whilst the government is putting in measures to provide the necessary infrastructure and the requisite medical equipment, I appeal to all and sundry to adhere to the COVID-19 protocols of hand washing, wearing of masks, and social distancing to mitigate the effects of the pandemic. With these unprecedented investments, His Excellency the President will not waver in his commitment towards deepening healthcare delivery at all levels and ensure that Ghanaians have access to high-quality healthcare. Now, ladies and gentlemen, to conclude, I will urge the community to cooperate and take good care of personnel that will be posted here when the facility is completed. Give them the necessary support so they will in turn give up their best. We are building a partnership, and may this partnership continue. I want to thank you for your attention, and may the good Lord bless us all. I thank you.
Thank you very much, the Honorable Akufo-Addo Menu, Minister responsible for health. Daebia wodia osun. Daewe nipa odi kan esun ya waka nipa bomu a enega na nyina etaye kire no de Nana Adodankwa Akufo-Addo. Enche bia one ye bekasa na nananom ye baaye no mo se amamre ye ntontwene enti moyi akusika Frimpoma Dorinda se ono ena omeje President Tata manemfa nanodisem embrain. Shall we receive Akusika Frimpoma Dorinda?
Penyini Nana Adodankwa Akufo-Addo. Nananom atena konya. Ekuni ni enintina yeshiam waha. Omaini mumpenifo. Ghana menyina. Mema munyina mwachio. Midiane Nana Akusika Frimpoma. Sene mijina ha. Na mese. Nana mesia meyo Nana Adodankwa Akufo-Addo. Ghana minda wasia ensado. Infiem mienu ni dunsia. 2016 ena penyini Nana Adodankwa Akufo-Addo yenyina yekọ ajenkro de kwam enibre eto abama Nana Adodankwa Akufo-Addo se wona wofri osono abusuamu osono kukurudu osono yedimachi ayemisa wawia osna yedimachi ayente hasuo mona mwagina kasamprebe poso atobo ponto penkura ma bopanda na sokoro so ama mansanche akuma adudadie moya bida yenimu se haw amanne ohiada ne yemfutukukoni dumso ahodu ayanam yi obeje yan afrimu no kwasem oya asre waduasabuo baako ade achi a wo chinchini kwa banyina ose Ghana man yensie ntia onyina wa ma sansa didi pame asona ne wayokobe asona duampem kwa de hyekonkura so keto aso adare oso wa ya asona ba ompre Predaji adie, were no sas wa yokoba na wo mie enti me ya sansa me fa dia me de kire me fanso a me fa ni boom makano me yo oshabodi bosha so Adodankwa show boy premen ni Dankwa Akufo-Addo waye bio Ghana mai yase ya bekoso ade wasedaka wona wo share yembo esa wo be ma yem free churches every say ebra na hochire adokoro Ghana mai na yaka yansamo kire man panyini dada na wode hye adum ne adan no Nana Adodankwa Akufo-Addo mobro hunufo eja tema eja abadaye eja wobaya no wabeyi nkwanua kese we ya free yekomu the free SHS aba ase emenyina yenkwa SHS free wa bra yentua teku dama sempua kaprempa na wa mampanyine na nado dankwa Akufo-Addo se nempo ya na wasia enchiri me beba ebeka se bema ba wo beye bi ye bekwaso ade wasedaka hye na nado dankwa Akufo-Addo Yasia say, one young Shahai, and my fofra and for one rubber sem, and one crutch sem, and Cecilia Mangana, no Santino, was some more friendly and Dachi, and more friendly and another so, and my friend about to me, Amagana to me a tomb, Pamacoso, and to free and such as Nayan to Kuna Damano, or your nim dufua, or young woman in for, or your cucodrufua, or your Nimoyan for and Nimoyan Rabedem, and in a free SHS. SCP, Esita, Ashri, Edna, Amampanyine na nado dankwa Akufo-Addo, Yada wasia, and Sada, and Soha, wasada planting for food and jobs abaye. Planting for food and jobs abaye. Ekwame ye friend sekwam, bin deyana, na yasewa mampanyine na nado dankwa Akufo-Addo batampe, Yada wasia, and Sado, Ghana maya bada swada wase. Ebra COVID-19 to ayem pofrim. Nani da swasaye. Na ya bisa ya wose. Ehemfa na yako. Every sanan Akufo-Addo sa Ghana dianki ya kayan fraho. Kata wanete bremu. Na nado dankwa Akufo-Addo yen senchireni. Ema ya hunu sa Ghana ya omai. Joseph wama ya yuase mwada biara day. Wama yendidida. Obi kachira ya se warenam no. Akadompe. Nanso na nado dankwa Akufo-Addo baye. Waseme ye Elijah. Mekasa namba badompe no ho. Enade wa ye ejuma. Enama badompe no ho. Se ye didi. Ema ya ho toye COVID-19 brema. Ni aso mampanyine na nado dankwa Akufo-Addo bema be. Apampamira watra watabanso aya kata so akata mpempema daja so. One kwasu ebru. One kwasu aso. One a woman yam 4 interchanges. One district, one factory. One village, one dam. One constituency, $1 million. One constituency, one warehouse. Single ticket inflation. Online passport application. And so, man, penny na nado dankwa Akufo-Addo. Wayabi was say, in penny for ne custom be. Abwa petu pre, was who be Benyamiana me yadia inti. Yadia mo yanko pasechi. Or Susan who send the tibone. And Tina nado dankwa Akufo-Addo. Bema ba one kwa waso dance what it shemase. And now bayano. Or so am I hospitals. Ya rebiara. Would ya fabra want na Hamagan and Jingu. Enter tempan samosa. And Tina nado dankwa Akufo-Addo. Why ya bio? Ghana mamba kwaswada wase. Afia chemu ya. Ana washe ya bo. Nebidu se won to me nye. Nansu wachira se. Mimi framanyo kwa papamu. Yadi amamu papa na bo masuo. Enti mentina ho. Anyan shehai. Ghana Jingu se enne bosha na bama ni yaso wo shabodi bosha so na nado dankwa Akufo-Addo onyina wo ma sansa didi pame asre wadu asabuo bako ade ache wo chinchiri kwa banyina wo se wo mansi asientia bema ba osiprekete otripuruku so nyan sabu akwa nyan sabu nkama kantan wo so ya bekoso ade wasedaka enne ase hospital sero e wase mensni bia enya ayaresabia mantamunsia bema benyansa ninim difuo ono na wajira kwanchan krampa wa hunu bi enti ya friend se ehunta hunu te kachre wono na o ma abato ena se waba na se wo hyase e wo trade kurodua yi mu a ne asema mpanyini yenya wudeni wese menhia wennim difuo wenwomanimfuo Ghana ma yanhia wa enka wo wotiri modemfo de wa fa dodo na wa COVID-19 bremi nana yada wose Ghana mai bekoso ade wasedaka moni adwuma pa won kwaso aburu won kwaso aso se enne nana ado se wo ya na moma yanka hunu se suputupu dum abrewa na abrewa dum supurupu ena bra supurupu dum sopropa na sopropa dum supurupu enti moma yanyina yanso na adubu na wamu enyedu na wontumi nyina pinti emfa yaresabia dodo na emra ayame menewo ya dachintia ayame menewo ya pomudintia shenipa ba konsansu nyame ani kato ena Akufo redru so egu panyimfo mpo se ba Akufo so nkyere danfo moma ye nyina yankai hunu ne se apese wo hoi oye kase a onyamfa oye madufuchie ana no maba anasa akokoba ono so frikosua mu na baaye woye meye no mampanyini ya Ghana bekoso afa ne ntoma pefra ama yakan yafra hunu ne se ye wo man Nana Addo bema ba wonkwaso Ghana mai ye bekoso ade wasedaka mo ene adwuma pa adwuma rampuntu adwuma ra wonkwaso a okudonto.
Yeah. Okay. Thank you very much, Akusika. Now we'll present to you the precious gift of the nation. The President of the Republic, Nana Addo Akufo-Addo.
Eminent clergy, Chief of Staff at the Office of the President, and officials of the Presidency, Ashanti Regional Minister, Minister for Health and Member of Parliament for Doma Central, the Minister for Local Government, Decentralization and Rural Development and Member of Parliament for Okre, the Minister for Works and Housing and Member of Parliament for Bantama, the Deputy Minister for Defense and Member of Parliament for Etrima Kwanwoma, Members of Parliament, CEOs of state agencies, Nana Echina Kwejain V, the representative of Asante, Nana Nubi Mfra III, Tredehine, the General Secretary of the New Patriotic Party, Ashanti Regional Chairperson of the New Patriotic Party, residents of Trede, fellow Ghanaians, ladies and gentlemen. Edi ade fa Ghana afana nyina enye bebia no bia tetwi no nti mo ba ma me kwan mare no potomo. Today is a happy day for Mother Ghana, and I'm glad that it is under my tenure as President of the Republic that the biggest ever investment in the nation's health care is being made. We are met this morning because of the ravages of COVID-19, which has affected every country on the planet. For us in Ghana, not only has the pandemic disrupted our daily lives, but it has also exposed the deficiencies of our healthcare system because of years of underinvestment and neglect. Indeed, in update number 8 of the Fellow Ghanaians series, I indicated that COVID-19 has revealed the unequal distribution of healthcare facilities in the country, as we have tended to focus our healthcare infrastructure in Accra, Kumasi, and one or two of our other big cities. As we have seen, epidemics and pandemics, when they emerge, spread to any part, can spread to every part of our country. We discovered that there were 101 districts in the country with no district hospitals, and we had to do something about it. The creation of the new regions also meant the government had to construct 7 regional hospitals for the new regions, including a new one for the Western region. See to the construction of 2 new psychiatric hospitals for the Middle Belt and Northern Belt respectively, and rehabilitate the Afian Kwanta Hospital in the Western region. This led to the formulation and declaration of Agenda 111. Following on from this initial announcement, a lot of work is being done to help make this vision a reality. And I'm delighted to be here with you in Trede to cut the sword symbolically for the commencement of construction of these hospitals across the country. So far, 88 out of the 101 sites have been identified, including this one at Trede, the site for the construction of the Etrima Kwanwoma District Hospital. Work on the other 87 sites also commence today. The acquisition of the remaining 13 sites will be completed shortly for work to begin. Each hospital is being constructed at a cost of $16.88 million United States dollars. That is 12.8 million United States dollars for construction and 4 million United States dollars for medical equipment. All the hospitals are to be completed in 18 months. Work will commence on the regional and other hospitals in the latter part of the year. These modern, fully equipped state-of-the-art hospitals will have facilities for outpatient services, including consultation facilities for medical and surgical cases, ophthalmology and dental services, a physiotherapy unit, maternal and child health unit, public health unit, 4 state-of-the-art surgical theaters for maternity, obs and gynae, accident and emergency, and for general surgery and imaging facilities. In addition, each hospital will have the full complement of male, female, pediatric, and isolation wards. Provision has been made for support facilities, which will include a kitchen, laundry, sterilization department, mortuary, energy center, maintenance department, and staff accommodation for doctors, nurses, and other health workers. Ladies and gentlemen, Agenda 111 has been carefully thought through to inspire activity and growth in various sectors of the economy and also help bring jobs to the youth. It is a Ghana-first agenda, and the following facts will help make the point. Firstly, a consortium comprising some 20 Ghanaian consulting firms made up of architects, civil, structural, electrical, and mechanical engineers, quantity surveyors, biomedical engineers, and other technical teams have designed these hospitals to reflect our unique domestic requirements, including impact of climate, socio-cultural conditions, and traditional practices. They will also supervise the construction of these hospitals, which will be built by some 250 domestic contractors and maintained by domestic facility management professionals as part of government's policy of developing domestic capability in the building and construction sectors of the economy. This will undoubtedly help retain most of the money in the country to engender further investment in the economy. Secondly, the hospitals are of a standard design and construction to provide a blueprint for speedy and cost-effective implementation of future health infrastructure programs in the country. Thirdly, the execution of Agenda 111 will require significant domestic inputs, which will give impetus to private sector investments into the one district, one factory policy. I expect Ghanaian entrepreneurs to take advantage of the opportunities provided by the significant investment and produce quality building and construction materials required by the hospitals. Fourthly, we have incorporated into this agenda a strategy of direct and indirect job openings to stimulate the economies of the various communities in which the facilities are to be located. These include the creation of an estimated 25,000 jobs during the construction and design phase, i.e., jobs for architects, civil, mechanical, electrical and biomedical engineers, quantity surveyors, masons, carpenters, welders, steel benders, painters, tillers, and related professionals and artisans, as well as other indirect jobs. Once completed, it will provide job opportunities for some 20,000 health professionals, and thus enable the Ministry of Health recruit more doctors, nurses, pharmacists, and other health professionals. In addition to these, there will be many indirect jobs for residents in the local economy. For example, for persons who will sell food, drinks, hospital consumables to the hospital, its staff, patients, and visitors. I am confident that this important investment will have a positive impact on many lives and livelihoods in the respective communities. Ladies and gentlemen, beyond the building of these new healthcare facilities, my vision is to help make Ghana the center of excellence for medical care in West Africa by 2030.
Thank you, His Excellency. God bless you.
Leveraging on Ghana's favorable status in the region as the most peaceful country in West Africa, a beacon of democracy of the continent, and a land of opportunities. This we will achieve by investing more in the development of our healthcare infrastructure, mapping our regional health facilities to specializations, as well as upgrading selected facilities in our regional and teaching hospitals into world-class standards. Excuse me. India and South Africa have shown the way in this regard. The relevance of this is reinforced by the fact that West Africa by 2030 will have a population of 500 million people. The goal is thus to position Ghana as an attractive medical destination with excellent medical facilities for our neighbors to patronize. Several countries have benefited from international medical travel. Benefits to these countries include enhanced GDP growth, improved healthcare infrastructure, foreign direct investments, tourism promotion, and importantly, halting the brain drain of skilled medical professionals. Indeed, research has shown that in 2016, for example, Africans spent some $6 billion United States dollars on seeking medical treatment abroad, of which Nigerians, our great neighbors, alone were responsible for $1 billion of this. In order to take advantage of the huge potential for medical travel, we began during my first term in office a program to revitalize healthcare infrastructure in our premier hospitals. Investments were made in the Kolebu Teaching Hospital in Accra to build a new 400-bed maternity and gynecology block, and a new 100-bed urology and nephrology center of excellence. Government will build on this foundation and include 2 additional projects currently in the planning stage, namely the Trauma and Acute Pain Center and a new surgical service block with modern inpatient facilities. These major investments in the Kolebu Teaching Hospital will contribute to its transformation into a modern world-class teaching hospital. Further investments are being made in the Akufo-Addo Teaching Hospital in Kumasi, beginning with the new 550-bed maternity and children block, specialized centers for infectious diseases, orthopedics, cancer treatment, cardiovascular health, specialist eye care, among others, will be assigned to some of the regional hospitals, including those to be constructed under Agenda 111. Whilst we upgrade facilities, we should invest in medical education and training of our health personnel, including expanding the use of IT for medical diagnosis and treatment in the Agenda 111 healthcare facilities being developed. This network of primary, secondary, and tertiary healthcare facilities will form the backbone of the vision to make Ghana the leading healthcare destination in West Africa. It is envisaged under a public-private partnership that the Ghana Medical Corps, a volunteer corps of medical specialists, which will tap into the skills and resources of Ghanaians and non-Ghanaians locally and abroad, using IT and telemedicine to support the delivery of healthcare and training, will be established by 2023. This will offer, in particular, to Ghanaian medical experts resident outside Ghana, the opportunity to give back to their motherland in ways that will support and expand healthcare delivery. All these programs collectively will position Ghana as a medical travel destination in West Africa, with the potential to add some $2 billion United States dollars to the nation's GDP by 2020, and in the process, create some 50,000 jobs in the sector. The implementation of Agenda 111 will be a huge undertaking, requiring commitment, cooperation, and diligence on the part of all: government, professionals, contractors, traditional rulers, opinion leaders, workers, and residents of the various communities to enable it succeed. We owe it to each other to prove that we can do it. Let me conclude by thanking the various stakeholders, especially the hard-working project coordinator and consultant, Kwame Nyako, and the conductor of the orchestra, my redoubtable chief of staff, Akufo-Addo Osei Opare, who have worked tirelessly to enable this project take off and remind all of us that we continue to experience the effects of the third wave of the pandemic. It is important that we continue to adhere strictly to all the protocols and directives government has put in place to protect lives and livelihoods. Continue to wash your hands under running water. Use alcohol-based sanitizers, hand sanitizers. Wear a face mask and ensure social distancing. These are the weapons of our welfare as we strive to reach the target of vaccinating 20 million Ghanaians, i.e., the entire adult population. I'm very hopeful that by the grace of God, we are on the threshold of something remarkable in Ghana. And I expect that within the next 18 months, God willing, we will all be alive and in good health to witness the commissioning of these hospitals. May God bless us all in our homeland, Ghana, and make her great and strong.
A round of applause for the President of the Republic, Nana Addo Dankwa Akufo-Addo. All right. Amampayi yabatinas na sene na Nana Achina kwejan okaye no project yesa share na amfo say oh President asmo ken de e wo dududu hospital makumako 80 there obade waye Amampayi also daipa ojudu hu yi na Amampayi ba bia okobia nso ya na okasa kyerɛn okasa na abebuom na your excellency have been following your wardrobe and then Amampayi okasa kyerɛn asema okai no atade e na wahyɛ na ohɛ Amampayi ne ntoma no ne din a ekasa kyerɛn asante amamremu yɛka ntoma e wasekyerɛ ene Amampayi na atade no anasa ntoma no ne din ene se woni sika yentwa blocks uniska yentwa blocks Amampayi wase wanya sika ene watwa blocks ro awo ha enti entoma no ekasa kyerɛn se ampa ne mo kanyina na wontimi wase wo sika watwa no blocks na blocks no so yekwakwye ewo ha eno na megyina so na matumensa ade afre Mr. Kwabena Nyako ono ene ye project consultant na adoforum Mr. Mochen so eman e ade a Amampayi afei the chief of staff and afei otufo obofo kese a wo ha and the honorable minister of health and the Ashanti regional minister ebeka na na trade hene ho na omako babia exhibition no ewo ye nyina ye betrase na Amampayi